People with the lowest heart rate variability have a 56% higher risk of dying from any cause. Your smartwatch is probably already measuring it with months of data, but most people don't know about it and almost nobody understands what their number actually means. I'm an ER doctor and I'll be honest, this wasn't something I was taught in medical school, so I've done my own research. And the relationship between this number and health is more surprising than I expected. So in this video, I'm going to explain what HRV actually is, what a good score looks like for your age, the evidence-based ways to improve it, including the most effective, which takes just 5 minutes a day, and at the end, I'll give my verdict on whether it's worth worrying about. Let's get into it. So what is HRV? So when your heart beats at 60 beats per minute, you'd think each beat is exactly 1 second apart, like a clock. But it isn't. There are small variations in the gaps between beats. So one gap might be 950 milliseconds, the next 1050, then 980. That variation, the difference in timing between successive heartbeats, is your heart rate variability. And here's what's counterintuitive. That variation is not a flaw, it's a sign of health. And here's why. Your heart is controlled by two competing systems, collectively called the autonomic nervous system. So think of it like a car with an accelerator and a brake. The sympathetic nervous system is the accelerator. It speeds your heart up when you're stressed, exercising, in danger. And the parasympathetic system, specifically the vagus nerve, is the brake. It slows your heart down when you're resting, recovering, digesting. And a healthy nervous system can rapidly switch between the two, so accelerate, brake, beat by beat. Now that rapid switching is what creates the variation, and more variability, or a higher HRV, is a good thing. When the system is under stress, through illness, poor sleep, chronic stress, low fitness, or just through normal aging, it loses that flexibility. The heart beats more rigidly, less variation, lower HRV. So the autonomic nervous system is the main driver of the variation, but it's not the only one. The heart's own pacemaker cells, the cells that generate each beat, have their own internal rhythm. And when the heart is under strain from disease, inflammation, or damage, those cells change too. And that also shows up in your HRV. So HRV is really a reflection of two things: how well your nervous system is functioning and how healthy your heart is. But does this matter for long-term health? So here's what the research shows. The largest analysis I found pulled data from over 38,000 people across 32 studies. Those with the lowest HRV values had a 56% higher risk of dying from any cause. The Framingham Heart Study, one of the most important heart studies ever done, found reduced HRV independently predicted cardiac events. And a separate study followed over 14,000 middle-aged adults for 24 years and showed a clear dose response. The lower your HRV, the higher your cardiovascular risk. Now, before you check your watch and panic, here's the important context. HRV is a window into your health. It's not a direct cause of disease. Think of it like a dashboard warning light. It can come on when the system isn't functioning well, but fix the issue and the light can go off again. And that's good news, because HRV isn't a fixed sentence. It responds to how you live. The same things that improve it are the same things that improve everything else. Better sleep, more movement, less alcohol, lower stress. Do those things and your HRV will improve whether you look at it or not. The lifestyle is what matters. The number is just one way of seeing that it's working. But for those who like the data and want to understand what their number means, here's what you need to know. So what is a good HRV? Well, it's not completely straightforward. There are a few important things to understand first. So first is that there are different ways to measure it. Most wearables, Oura, Whoop, Garmin, Fitbit, use a method called RMSSD, root mean square of successive differences. Apple Watch uses a different method called SDNN, Standard Deviation of Normal to Normal Intervals. So they produce different numbers that are not on the same scale. Neither is necessarily better or worse. They're measuring the same thing, but in different ways. The second is that accuracy varies between devices. A 2025 validation study found Oura had the best accuracy within about 6% of a medical grade ECG. Apple Watch was the least accurate with about 29% error. But even a less accurate device can reliably track your trend because the error is consistent, and that's what is most important. The third is genetics. Twin studies show somewhere between 47 and 74% of HRV is genetic. So someone predisposed to a low baseline may never reach 70, for example, no matter what they do. And that's fine. A low number on its own doesn't mean you're unhealthy. And finally, age. HRV naturally declines with age, and that too is completely normal. With all that in mind, here are some rough averages so you have a reference point. For Oura, Whoop, Garmin and Fitbit users, in your 20s, anywhere from 55 to 100, in your 30s, around 55, in your 40s, around 40, in your 50s, around 35, over 60, around 25 to 30. For Apple Watch users, the typical range is roughly 18 to 76, averaging around 36, and typically higher in younger people and getting lower with age. By your 50s, your HRV is roughly half of what it was in your 20s. That is not a sign of disease, that's normal aging. So what does all this mean? Well, comparing your number to someone else's is almost meaningless, even if you're using the same device. What matters is your own personal trend, whether your number remains stable as you age or is moving in the right direction in response to better lifestyle choices. So pick one device, stick with it, track your own trend over time. Don't compare to other people. Don't compare across devices. Your trend is what matters. And there's one more thing most people get wrong. Most people assume higher HRV is always better, but too high can be problematic also. Data from over 50,000 people in the UK Biobank and confirmed by other large studies showed a U-shaped relationship with mortality. So, very low HRV, higher risk, but very high HRV, also higher risk. Very high HRV can indicate irregular extra heartbeats, inflating the reading, excessive vagal tone, or even be a risk factor for atrial fibrillation. As one leading HRV researcher put it, a stable HRV is often a better goal than a high HRV. Another reason not to chase a number, a consistent or gently improving trend is what you're looking for. And as we age, there are other factors that affect the number that need to be considered. So medications are the big one. Beta blockers, commonly prescribed for blood pressure, increase HRV. They block the accelerator and allow more of the brake to take effect. So a good HRV score on a beta blocker may be partly the medication, not your underlying health. Antidepressants do the opposite. Tricyclics and SNRIs significantly reduce HRV. So if your HRV is low and you're on antidepressants, that's expected. It is not a reason to worry, and it is absolutely not a reason to stop your medication. Talk to your doctor about any concerns. For women going through menopause, HRV changes are also expected. The drop in estrogen that drives menopause also affects your autonomic nervous system. Before menopause, women actually have higher HRV than men, but after menopause, the levels are similar. The point is, context matters. A number without context can cause unnecessary worry, and that is exactly why the trend matters more than any single value. So what actually improves HRV? Well, I've ranked the following interventions by strength of evidence. Number 1, slow breathing. This one surprised me. So breathing at around 5 to 6 breaths per minute, in for about 5 seconds, out for about 5 seconds, has the largest evidence base of any HRV intervention, over 200 studies. It works by directly stimulating your vagus nerve, the brake, And just 5 minutes a day produces measurable improvements within 2 to 4 weeks, and it costs nothing. Number 2, aerobic exercise. So a meta-analysis of 16 randomized trials found regular aerobic exercise consistently improves HRV, with changes showing after around 8 weeks. Regular exercisers have HRV values 20 to 30% above their age-matched peers. And it doesn't need to be intense. Just get a little out of breath. Walking, cycling, swimming, dancing all count. Consistency matters more than intensity. Walking has been the cornerstone of my own health transformation over the past number of months, and my HRV has gone from 60 to 75. If you're interested in learning more, I have a free guide and you can get that in the pinned comment below. Number 3, alcohol. So regular heavy drinking suppresses your baseline HRV over time, and recovery from that takes months. But even a single night out has an effect. 2 drinks causes a 28 to 33% drop. If you wear a tracker and drink, you'll actually see lower readings the next morning, with recovery the following day. Number 4, sleep. Each extra hour of quality sleep adds a small but meaningful amount to your HRV. 1 bad night drops it, with recovery again after a night or 2 of good sleep. And finally, number 5, weight loss. If you're overweight, losing 10% of body weight increased HRV by 39% in one study. And what didn't make the list? Mindfulness meditation. Despite its many benefits, a rigorous meta-analysis of 19 trials found mindfulness alone does not reliably improve resting HRV. If your meditation practice includes slow breathing, however, that's likely where the HRV benefit is coming from. So worth adding to your meditation if you don't already include it. So there you have it. There are no HRV specific hacks. Better sleep, more movement, less alcohol, healthy weight. You might hear me repeat this a lot on this channel, but it's the basics done consistently. So should you worry about your HRV? Honestly, probably not. In the ER, I see the end result of unhealthy lifestyles every day, the heart attacks, the strokes, the death, unfortunately. And HRV will never factor into my clinical thinking when someone comes through the door. What is far more meaningful is the patient's lifestyle. Do they sleep well, move enough, eat real food? These are the things that determine long-term outcomes. HRV is simply a reflection of that. So for most of you watching this, don't worry about your HRV. Put your energy into living healthily. That's what actually moves the needle. And on a personal level, I will not be paying much attention to it, perhaps a passing glance every now and again. But if you do track it, here's what's worth paying attention to and what isn't. A single bad day, you can ignore it. Poor sleep, an extra glass of wine, a stressful week. Normal day-to-day variation is 10 to 15%. One reading really means nothing. It would be far better to follow weekly and monthly trends. A sustained drop, though, is different. If your 7-day average falls well outside your normal range for more than a week, and it comes with symptoms like unexplained fatigue, exercise intolerance, palpitations, or dizziness, that's worth a conversation with your doctor. But because of the symptoms rather than the number. And if you have an existing heart condition, the picture is different. Talk to your doctor. Although you might get a bit of a blank expression if you mention heart rate variability, as most doctors don't know much about it. So here's what I want you to take away. HRV is a real evidence-based metric. It reflects your autonomic health and your cardiovascular health, and the research linking it to long-term outcomes is there. But the number is not the point. The lifestyle is the point. Sleep well, move more, eat real food, moderate your alcohol, don't smoke. Those things improve your HRV, as well as your resting heart rate, your blood pressure, your cardiometabolic health, your energy, your mood, everything. HRV is just one more window showing you that your good lifestyle is working. If you like data, track it. If you find it motivating, use it. If it stresses you out, close the app and go for a walk. That walk is doing more for your health than any amount of staring at a number on a screen. Now, if you enjoyed this video, there's a link on screen to the playlist where you'll find more of the same. Please leave a comment below. Do you track your HRV? What device are you using? And does the data motivate you or stress you out? I love hearing real-world experience. And if you want more evidence-based health content, no hype, no biohacks, just what the research actually shows, then click subscribe. Thank you so much for watching.